Tonight, 3,051 people are in North Carolina hospitals with coronavirus. And while that number is not a record high, it is dangerously close. New at 11, CBS 17's Maggie Newland digging deeper into one treatment that, if given quickly enough, is helping to keep high-risk patients out of hospital beds. Maggie.
Angela, you may remember President Trump and Chris Christie both received monoclonal antibody treatment after their COVID-19 diagnosis. Well, WakeMed is giving out that same treatment, and after giving it out to hundreds of high-risk patients, one doctor says he's seeing some signs of hope. 7 days a week, the infusion center at WakeMed offers monoclonal antibody treatments for high-risk COVID patients.
These antibodies directly attack the virus.
Doctors must act fast, giving the treatment soon after symptoms appear. Later in the illness, Dr. David Kirk says it could do more harm than good.
And that's one of the reasons that we have been given infusions 7 days a week. We do believe that 24 to 48 hours, even over a weekend, would make a difference.
The goal, to keep patients at highest risk of COVID complications out of the hospital.
Based on the trial data and based on our experience, we think it reduces hospitalization by at least 2/3.
Dr. Kirk says WakeMed has given the treatment to more than 440 patients so far.
Then we probably kept 40 or 50 people out of the hospital. And we do know that these high-risk patients that come into the hospital, they probably have a 20, 30, 40% risk of death.
Is this the only real treatment we have right now to give people to keep them out of the hospital? Do we have any other options at this point?
We don't. No. And that's what the physicians in our community that have partnered with us, they've been so excited.
To get the treatment, patients must be 65 or older or have certain medical conditions. All patients need a doctor's referral.
It's a very complicated risk-benefit for the patient. So we really want it to be that private discussion between a patient and their provider.
While the treatment is still investigational, Dr. Kirk believes it shows promise for some patients.
We know it's those very high-risk patients that are going to come in and not do well, and it's finally something that our docs in the community can provide these patients to give them hope.
Now, the treatment is for people with mild or moderate illness. It must be given within 10 days of symptoms appearing, but the sooner the better. So Dr. Kirk says if you are eligible or think you're eligible for the treatment and you start to develop symptoms, you need to get a COVID test right away and immediately contact your doctor to see if it might be a good option for you. We're live at WakeMed. Maggie Newland, CBS 17 News.